I'd like to thank SAGES for the opportunity to present our research, and I'd also like to thank our moderators, Dr. Ioniti and Dr. Vitale. My name is Alexander Shope, and I'm actually a second-year medical student at the Penn State College of Medicine, and I'm here to present our study, the forced comparison of commercially available suture passers. I have no personal disclosures related to this study. However, the senior author, Dr. Eric Pauli, has these disclosures. Suture passers are a commonly used surgical tool, and they're used in a variety of surgical settings, such as port site closures during bariatric procedures, open and laparoscopic mesh fixation during hernia repair. They can also be used in organ pexy when gaining access for enteral feeding and in single-site surgeries. So the purpose of our study was to compare the insertion force of 9 commonly used suture passers in order to see if we could find any differences between them. We hypothesized that the instrument design, such as the diameter, the tip shape, or in the location of the suture holding mechanism, would result in different insertion forces. So we built a custom designed support structure with 3D printed parts in order to hold a digital tensiometer. We cut uniform sections of porcine skin, subcutaneous fat, and rectus muscle to use as our specimen. A uniform skin nick was then used before each suture passer was passed through our model 3 times. Now, this is a full picture of our rig, and you can see with the arrows the 3D printed parts holding the tensiometer. This is a close-up view of the platform where we placed our specimen with the hole that you can see here, which was used in order to allow our suture passers to pass the whole way through our model. And on the right, I would like to point out the mesh underlie, which we secured to our specimen with some towel clamps. Now, we were testing 2 conditions. We tested the empty suture passer, as well as the suture passer holding O-proline. And we tested each of these conditions through native abdominal wall plus underlie mesh or composite mesh, and abdominal wall plus EPTFE mesh. Now, this is a picture of the 9 suture passers that we tested, and as you can see, they come in a variety of shapes and sizes. I'd just like to take a moment to highlight some of the distal tip configurations of the various suture passers. Here you see a hollow tip design, which can be found in the WEC, the Medtronic, and the Artisan and Unimax, which both had identical mechanisms. A diamond-shaped cutting mechanism, which was found in the Cook straight and curved, as well as in the Gore, and a taper-tipped mechanism in the Carter-Thomason and the Reverden. Now, this is a complete list of our data that we collected during our study, and I'd like to draw a few comparisons. All comparisons I'm going to present to you are significantly different. We began by comparing each individual suture passer to one another. So when we compared the smallest suture passer, the Gore, to the larger Carter-Thomason, we found that the smaller suture passer required less insertion force. But when comparing 2 smaller suture passers, the Gore and the Unimax, passing them through the EPTFE polyproline mesh, again, the smaller suture passer required less force. But when we added suture to this situation, the trend actually reversed itself, and the larger Unimax required less force. Looking at the larger end of the spectrum, the NovaPass straight and the Carter-Thomason are virtually identical in diameter. However, the NovaPass in all 3 of these scenarios without suture required less insertion force. So based on this variability that we were seeing in our initial data, we decided to try grouping our suture passers. So we grouped them based on their diameter into small, medium, and large groups. So through no mesh with suture held, we found a significant difference between the groups. And this difference was seen between the small and large and the medium and large groups, with both the small and the medium groups using less insertion force than the larger group. When passed through both types of mesh, we also found a significant difference. However, this difference can only be seen between the small and large groups. And as you can see here, the small, again, was outperforming the larger groups. So we were still seeing a little bit of variability with our results, especially when adding suture to mesh, so we again decided to try to re-stratify. This time we went based off of the tip design. So through no mesh, EPTFE, and EPTFE with polyprolene, without holding any suture, we found a very significant difference between all three groups, where the diamond-shaped outperformed the hollow-tipped, which also then outperformed the taper-tipped. And this happened in all three of the scenarios without suture present. Now, adding suture to all three of these groups, we also found a significant difference. And we found a difference between the diamond-shaped and the taper-tipped. Again, the diamond-shaped was outperforming the taper-tipped. And then we also found a difference between the hollow-tipped and the taper-tipped, with the hollow-tipped requiring less insertion force. So this led us to our last comparison, where we wanted to look at the actual tip configurations, constant versus variable shaped. Now, when I mean constant shaped, the Nova Pass, for instance, as you can see, this is a picture of it in the open configuration and then in the closed holding suture. Its diamond-shaped cutting tip hasn't changed at all. Now, in comparison to the Carter-Thomason, as you can see here, the Carter-Thomason is fully closed, but when holding suture, it actually is open a little bit. And we were hypothesizing that this would create a little bit of drag. But when we ran through our data and used some statistical analysis, we found that this really didn't have much effect. We did, however, find that adding suture to those two particular suture passers significantly increased their insertion forces. So some of the limitations of our study that I'd like to mention, our support structure was not optimally designed for curved suture passers. And we also did not assess the effects of torque or shaft bending forces, which can be a real consequence in actual OR settings. And since our study completion, the Gore suture passer is no longer commercially available. So the conclusions of our study: suture passers are available in a wide array of configurations. When you eliminate where suture is held, smaller diameter requires less force. And distal tip configuration, such as cutting diamond configuration or hollow tip configuration, which both act in a cutting mechanism, outperform a taper-tipped mechanism, which dilates. But these changes in tip configuration when holding suture did not have an effect on the insertion force. So consideration should be given to these factors when designing or choosing a suture passer for clinical use. Thank you, and happy St. Patrick's Day.
That's great for me.